Major versus minor surgery. I was chatting with somebody after my wife had, her delivery, C-section. And she was like, yeah, she's going to take a while to recover. I mean, she underwent major surgery. I was thinking, major surgery. I don't know if I agree with that term. I guess she went through surgery, and it's a surgery, which is pretty major. But medically, well, I don't know, right? So in the medical field, we have major versus minor, right? We have procedures versus surgeries. So I think procedures versus surgery is easier for me to define because procedure is something a medical doctor does. Internal medicine trained subspecialty. Surgery is something a surgeon does. Sometimes it sort of overlaps and sometimes there's some confusion. For example, if it's invasive, then we say it's surgical. If it's non-invasive, we say it's a procedure. But, certain things sort of cross the boundaries. So interventional radiology, I would say they do procedures. Some of their stuff is pretty major, pretty important, right? Who defines major? Is it major defined by significance to the person? The patient defines it? As in, this was a big deal. Is it defined by doctors? A Whipple, that's definitely a major surgery, sort of taking out some pancreatic cancer, right? Rearrange all your organs internally. Whole day thing, major. Heart surgery, major. Crack open your chest, special anesthesiologist, blah, 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 major. Remove your gallbladder, minor. Yeah? No? I mean, they still open you up, but they have laparoscopic methods. They just poke some holes in, but I don't know. What about cutting off a toe? Is that minor? Because it's just a little toe and not that big of a deal. But I didn't talk about fingers. Well, it's not a big surgery. It could be quite involved, though, repairing tendons and nerves. Could take quite a few hours. Does that make it major? Or is it major because your fingers are so important you need a specialized surgeon to do it? You don't just have an orthopedist do it. You have a specialized orthopedist who did additional training in hand surgery. Does that make it major? Who really cares whether something's major or minor surgery, right? I mean, it's surgery. That's not true, though. We do care. At least I care. And I feel that's the idea, because if you went through major surgery, we're going to say, well, it's going to take you some time to recover. Probably need some narcotics, blah, blah, blah. Whereas if you went through something minor, we're like, no, you shouldn't need. You should be better, right? I think part of it is the expectation of what you're like afterwards. Major surgery, you need to cover. Minor surgery, you don't really need to cover that much. But that's all complicated because it depends on the person. I would say in my wife's case, she had her belly cut open. A lot of pain involved. I agree. Major surgery.